Welcome back. If you've just tuned in, this is the Health and Wellness Show. My name is Chebet Birir, and like I said, today we are talking about mental health, which is a very important and close topic to my heart. And we are talking about access to mental health services. We are talking about our experiences. Before we went on a break, Faith was talking to us about the situation in the UK and how they are combating mental health issues. But I also want us to talk about the access to treatment, and even for people with mental health issues, do they know and how do they know that they are going through that? And Tom, you said that you didn't even know there's something about counseling, that you didn't know the role of a counselor. A lot of people are going through depression and they don't know it's depression. And by the time we try to help, they've died by suicide. So what can you say in terms of knowing what you're going through?
Actually, what I can say is that many people are fighting battles unknown. They don't know that that there is an interaction between a counselor, there is a difference between a psychiatrist and a counselor, psychologist, and so, and also a mental health nurse. So you get, for my case, the only thing that was close to access to counseling services was through guiding and counseling in high school. And when we went to most of the time in our guiding and counseling classes, maybe I'm facing, this is my teacher there. My teacher is the one doing that session to me. And the next minute I'm with that same teacher in class and is abusing me the way I'm dumb in class, you know. So it doesn't even build upon that. Sometimes you go to that session, maybe the only thing they will do to you is maybe they'll advise you to go to the chaplain. The chaplain, instead of talking to you, they will pray to you. But still you have not got enough solution to help you navigate through the problem that you're facing. So most of us didn't know that kind of a thing. You can go to hospital and seek that. And even if we now came to know that, we were not sure about the kind of medication that is required and how much money that one takes. So there's a very huge gap between those who know these services exist and those, especially in the villages and marginalized communities. So for me, I would say that I didn't know, and by the time I came to know it, it was already almost late. I was in the middle of a very difficult condition that no one could help me. I had dropped even in my classwork. I was not doing so well. So that's what not knowing what is ailing you can get you into.
Yes. Thank you, Tom. Dr. How has it evolved over time? I know awareness has become a bit more prevalent. I mean, a bit more, there's more awareness at the moment, but how has it been in terms of awareness, people knowing what they're going through so that they seek help from the 90s to now? What can you say about that?
Okay, let me follow a little bit up from him.
Yes.
One of the things that is very, if we have children, one of the things that could show that there is something going on in a family is just the behavior of the children. Sometimes the children are actually acting out because of the dysfunction in the home.
Absolutely.
And or some other dysfunction. And one of the big indicators that we have these days is to watch us, you know, what are the behaviors of the children? Is a child who is being well behaved, suddenly they are not behaving very well? What is triggering that? Or their grades start going down. You mentioned that your grades went south. Yeah, and that's normally because there's a psychological turmoil going on. So I just wanted to highlight that because those are just, you know, things that we can watch. The teachers who know will watch that and will call the parents in and say, something is going on with your daughter. We notice they are very sullen, they are very withdrawn. They are not doing their homework, and yet they were doing very well, or they are irritable, or they are sleeping in class, or their grades have gone south.
Those kind of things
are those kind of things are important for parents to be aware of. What has happened in the with the whole area of mental health? Like my sister said, one of the things that has happened is there's been a lot of increase in training. We have a lot of psychiatric nurses. For you, I think you call them something different in UK.
Yeah, we're registered mental health nurses.
Registered mental health
yeah.
nurses. Here they are called psychiatric nurses.
Yes.
There's a lot of training of clinical officers who are trained in issues mental health. Every medical student who goes through any of our universities is equipped now to be able to give at least be able to make quick assessment and start training, start people, helping people out. The only danger that there is that our doctors, our clinical officers and nurses are very, very overwhelmed because we have a huge gap. We still don't have enough personnel.
Professionals.
The whole area of counseling, we've come a long way. I remember in the 80s, in the 90s, you could probably get only a certificate in counseling. Right now, you're spoiled with choice. You can get all the way from counseling psychology all the way up to PhD
Clinical
level.
psychology,
Clinical
yes.
psychology, the same. So, but I think for me, the biggest movement has been in the area of advocacy.
Advocacy.
And I want to commend people like you and you who are involved in and be real.
Yes.
You know, you will never, you might never know the kind of work you do in the media in helping bring down stigma in education and letting the world know that has gone a long way. That the whole area of advocacy has been, it's been very exciting from in the 80s when I became a young psychiatrist, late 80s, I was even afraid to tell people that I was a psychiatrist.
Wow.
Yeah, because it was like there was stigma, even being a mental health worker. These days I'm very proud to be one because, because there's knowledge and there are conversations going on.
Yes.
There are conversations going on. There have been many conversations going on this last week because of the suicide day, which was on Wednesday, last Wednesday. Many good conversations going on. People coming out and saying, I've been there, our family has struggled with this, and
and those conversations were very good, actually. Yeah. And that is actually where I picked that and thought that we should actually talk about religion and spirituality and mental health. And that was a good forum. It was a forum on a lot of religious leaders in Kenya who were invited to talk about mental health. Because then again, the discussion was that these religious leaders are the gatekeepers. The congregants, when they have mental health issues, the first person they will go to is a religious leader. And so then the topic of discussion was, how do we help them in a wholesome manner, so that, of course, spirituality is important, but also professional counseling and treatment is important. And Daktari, I'd like us now to go into that, religion and mental health and spirituality. What can you say about it now in the country? Of course, there's progress, but even then, we still have very many suicide cases in the country. 4 people die by suicide every day in the country, every day. So that's a huge number. What do you think needs to be done in terms of course, there's access to treatment, that's one thing. But let's now talk about spirituality and religion.
90% of the people who attempt suicide is because there is an obvious mental health issue.
Yes. And
so,
go ahead.
So what we really want is that when somebody is attempting suicide, is not of them to be persecuted and prosecuted, but to be
Treated.
given compassion, understanding, empathy, and to find out what has gone wrong, and then for them to get treatment, because a lot, mental health is treatable.
It is.
And that, the two prongs of treatment basically is psychotherapy, where counseling comes in, and some of them need the medical
Medication.
interventions.
Yes.
There are several medical interventions. So that was a big thing.
Yes.
Now, your bigger question is the
Religion and
spirituality and mental health and where they intersect. We need to backtrack on that and just realize that in each one of us, we are both a body, which is what you can see.
Yes.
A physical body, which was, when I was a younger doctor and a student, which was the focus of the medical world.
Body, the physical
we wanted
body.
to treat the body.
Yes.
You have malaria, we treat the malaria. You have a malaria, In fact, we used to talk about this is the hypertensive, or this is the malaria case. But the language has changed. This is to now this is the patient who is suffering from
Malaria.
So there is the body, but we all have a soul. Now the soul is basically, not to make it too simplistic, but the soul is basically has three aspects. It has the thinking processes. That's what we call the cognitive side of things, and that's the part of us which says, I think.
Because I am.
And then I think, that's what controls our thought processes.
Yes.
The soul also has the emotive side of us. That is the heart, which says, I feel. And the feelings are not bad in of themselves. They can be positive feelings or negative feelings, but they're not objectively bad. I mean, when you're depressed, you're not objectively a bad person.
Yes.
You are just a sick person.
Yes.
So that's there's that. And then there is volition. That's a part of us which makes decisions, which says, I decide this. And these three things is what helps me to interact with another
people.
person. That is what helps us to be a community. That's what creates humanity.
Okay. We'll come back to you and you'll continue with that.
Okay.
But I also want us to listen to Faith. What is your perspective on spirituality and mental health?
I find that very interesting because I think people are, my experience,
Yes.
working with, let's say, patients in the UK, people are not ready to talk about their religion or spirituality because they feel it's a contrast, and while here in Kenya, actually, everyone, I mean, a lot of people have that connection. So there, it's difficult to talk about that with their mental health. Here, it's the complete opposite. So there's a conflict there, and I think I find it interesting here because we've grown up in the churches.
Yes.
And we go to church. That's the way we've been brought up. But at the same time, I find that like too much of everything, too much of food, too much of water, even if it's good, can actually causes an imbalance. And sometimes if there's too much where there's too much of something where you don't recognize your mental well-being is being impacted. And as Daktari said, things have to work in a balance. So your social life, your internal life, your purpose in life has to be there. And if that is not there, then something is if you're not able to function in the community properly, then it means something is not right. So I think for me, having being religious, having some kind of spiritually, like a higher power, is important. but in a balancing thing where you have to balance your mental well-being. You have to recognize that your mental health well-being is, if it's suffering, then you need to seek the professionals for that. Of course, there's the religion where you get peace. You know, people, and when you find peace, there's a healing in that.
Yes.
But if you need medication or some other kind of intervention, then you need help for that. So, for me, it's about balance.
I like that, because now, when now we bring in spiritual leaders, we call it over religiosity or over spirituality. When you find that a congregant has gone to a preacher, and the preacher actually just decides that this man or woman is demon possessed, and so they start to exorcise and remove the demons. And Daktari and Tom, let's start with you, Tom. How do you think we can incorporate religious leaders into the mental health space, considering that you're a counseling psychologist? How do we explain to them that, you know, yes, you can pray for this person, but we also need to treat this person so that they can be whole?
From where I sit, I'm a Catholic by denomination, and there's something in our church called confession. I always equalize confession to just being open and sharing what you're facing or what you're fearing. It's one line of defense that can really contribute hugely to healing. I would say that the clergy members should not focus only on prayers, but rather as people who interact mostly with a huge number of congregants around them, they should focus on encouraging the people to come out and speak whatever they're facing first before even getting know. You know, there's I used to know, and no pun intended, that I used to see that unafika unaambiwa piga magoti tukuombee, even before they say, ama wanakuambia tumeona kitu fulani, tumeona watu huko, but what you're facing is more psychological than physical, you know.
And physical.
And spiritual, like unakwambia kuna ule shangazi yako sijui amefanya nini. So there's that thing that needs to be put in the right position. People are having issues and they don't know that they can access counseling services or social support. But here you are having them around you. Instead of now changing the narrative and trying to realign them with the professional services that are required with them, you keep on now encouraging them to read the Bible and do prayers. Someone has a money problem. There's no way this person is going to read the Bible to get the money. This person needs mentorship on financial support. This person does not even need counseling services, you know. This person needs mentorship, training, and now capacity building to enable this person to get over whatever they are facing. So there's a lot that can be incorporated in church services, especially during these church camps, so that the clergy are empowered to a level that they understand that there's something called mental health, there's something to do with spirituality, and there's something to do with physical empowerment. That is the only way we can collectively say that we are helping community or we are building a community, because suicide thrives in the absence of a community. But when there's a community of people who understand situations, suicide can never thrive. Yeah.
Thank you so much, Tom. We have very little time left. Yes, but please.
Something very important here. The first place that anybody who has got any distress in our culture, the first place that they will go to is to a religious leader.
Church.
So way before they even think about, you know, counseling or hospital or any other thing. So so the religious leaders then become a very critical cog in us managing the mental health situation. And
absolutely.
And the way some of us think is this: when you have the gatekeepers, all the gatekeepers need to do is to okay it so that it trickles down to the rest of the community.
To open the gate.
And yes, and then we equip the average church religious leader with basic
mental health training.
tools. We give them some tools, and very important for them to recognize there are things that they will need to refer.
Yes.
If we can just do that, we will have done a big service to our people in Kenya.
Absolutely. Thank you so much. And I like that there's actually some progress. From that religious meeting, the next week was a religious leaders training on mental health.
Yes.
So I think we are
and
making a step.
There's a lot of that going on behind subterraneous, without too much fanfare. There's a lot of that going on.
Yes, it's a good step. Now, as we wrap up, I'd like us to have, I know mental health could take a whole day, but because we have limited time, let's just have our parting shots and then we will close the show. Of course, we will have you guys later on for this discussion. Let's start with you, Faith, and then Tom, and then Daktari.
I think for me, it's let's start with our children. Let's create awareness. Let's prevent. If we can prevent the crisis, let's bring safeguarding in place so that we don't get to the mental health crisis.
Yes.
Great.
Thank you so much, Faith. Tom?
All I would say is that I'll just have to take some time to tell people we need really much training and much policies in place that can be implemented to support the growth of advocacy programs in the country. And that can only be achieved through a collective responsibility of the community, which incorporates both the clergy, the administration, and general members, even school stakeholders, so that we have a collective approach and a holistic approach to mental health.
Absolutely. Thank you so much, Tom, and thank you for the good job that you are doing. And finally, Daktari.
My final thought is this. Mental illness is treatable. Like any other illness, mental health is treatable. We struggle because we don't have enough manpower. But let's not sit with our people who are suffering, because mental health is treatable. And every government hospital is a mental health center. There are people there who are trained. There are clinic officers, there are nurses who are trained in that. Every doctor is trained to be able to give you some basic training. So do not suffer there. And of course, if you can get access to the psychiatrists and the psychologists, that is good. But let's not keep our people from being treated, because there is treatment available.
Thank you so much, Daktari. Thank you so much for coming to talk about mental health on the show. Of course, I wish that we would have continued. It's a very important topic that I know cannot stop with 1 hour, and we cannot exhaust everything in 1 hour. But I do appreciate, because somewhere someone has been informed. And of course, let's continue to spread the awareness. Thank you for the good job that you're doing, and thank you once again for coming to the show. All right, that's where we wrap it up. Of course, we've talked about suicide prevention. We've talked about our challenges in terms of mental health access in the country. And of course, the first step to having a complete mentally healthy society is to decriminalize attempted suicide. That means that whoever attempts suicide should not be taken to jail, but should receive the psychosocial support that they need so that they can become a whole person. Thank you so much for tuning in. Let's continue to have these conversations on social media. Of course, our social media channels are KTN Home, KTN Entertainment. My handles are Chebet Birir across all platforms on X, and Instagram, and Facebook. I talk a lot about mental health issues. So in case you have anything to share, please feel free to reach out to me. Thank you so much for tuning in. This has been the Health and Wellness Show, and my name is Chebet Birir. Have a lovely day.